Hi guys!
Hi.
I'm Tran.
I'm Rebecca.
I'm Tristan.
And I'm Darian.
We are the nursing student at Concordia University, and today we're going to present to you guys about what acute glomerulonephritis is through our little videos, and I hope you're going to like it.
I'm here today in Portland, Oregon to find out how much people know about acute glomerulonephritis. My guess is nothing at all, but we could be surprised to see what people think they know and what they come up with when they're on camera.
All right.
So, you are a national spelling bee champion.
Obviously.
Can you spell glomerulonephritis for me?
Glomerulonephritis. Glomerulonephritis. Glomerulonephritis.
I think that's right. Great job.
Thank you.
Okay, so I'm here asking you, what do you know about acute glomerulonephritis?
I totally have that. Ever since I got COVID, everything tastes like blue jello, and my heart skips a beat and it swells, and I totally have it.
You totally have it.
My
okay.
doctor told me so.
You may want to see a doctor about that for sure.
did.
Okay, yeah, great. That is totally not right, but we'll go with it. Have a good day.
Thank you.
Okay, so we're going to discuss the pathophysiology behind acute glomerulonephritis. It is a disorder of the kidneys that specifically affects the membranes of the kidneys glomerulus. The glomeruli are the parts of the kidneys that are responsible for filtering our blood. So with this disease process comes major bodily dysfunction, as those waste products are very toxic to the rest of the body when they are not excreted. The most frequent etiology or origin of this condition is a bacterial infection that does not resolve and progresses slowly. The most commonly associated bacteria is group A Streptococcus, which often starts off as pharyngitis, also known as strep throat. Sometimes it can also present as a skin infection known as impetigo. Other less typical etiologies that lead to the disorder include viruses, other bacteria, funguses, some parasites, infections like mumps, or even some autoimmune disorders. Welcome to the show. Can you tell me what are the signs and symptoms of acute glomerulonephritis?
The signs of acute global uniteditis. Let me tell you about the signs, man. The signs, they're everywhere. It's Zuckerberg and it's Elon Musk and they're taking over the world. It's Meta Twitter. I have it, you have it, we all have it.
So now we're going to talk about the signs and symptoms of AGN. With a high blood volume, decrease of albumin in the blood, there is also decreased colloid and oncotic pressure, causing hydrostatic and oncotic pressure imbalances. When hydrostatic pressure takes over, the individual will experience sudden onset of edema or swelling, which is one of the major initial clinical manifestations of this disorder. Also, due to this decreased filtration of the blood, there is a decrease in urine production known as oliguria. The body retains this fluid instead of excreting it, which leads to hypervolemia. Like turning up the flow rate on a hose, an increased amount of fluid is trying to force its way through the vessels of the body, and this creates high blood pressure or hypertension. These signs and symptoms appear 1 to 3 weeks after a streptococcus infection. Edema is often noted as puffiness in the periorbital area around the eyes. There will be noticeable decrease in urine output, and the urine may be dark or cloudy due to presence of blood and protein. Hypertension will be evident when the patient's vital signs are taken. The patient may also show signs of overall weakness, fever, abdominal pain, and tenderness of the costovertebral angle, which is located at the bottom of the posterior rib cage. Next, we're going to talk about just exactly the process of the disorder. This disorder starts with an antigen-antibody reaction that prompts the inflammation process to be initiated. When an antigen or a foreign agent such as the Streptococcus bacteria enters the body, it causes antibodies to be synthesized and an immunological response follows. There are two theories that may explain what happens during this disorder. The first is that the antibodies strike an attack on the antigen while simultaneously forming complexes with one another. These complexes can roam freely throughout the bloodstream until they travel to and deposit themselves in the kidney's glomerular membranes, where they interfere with the filtration function of the kidney. Supports a mechanism called molecular mimicry. This is where the antibodies attack the antigen while also attacking the glomerular by accident. Injury to the glomerular causes inflammation and the capillaries become hyperpermeable, which allows for the loss of red blood cells and albumin via excretion in the urine. A urine analysis test will show proteinuria, which is protein or albumin in the urine, and hematuria, which is blood cells in the urine. So, what part of the body do you think is affected by acute glomerulonephritis?
My cute face? The primary organs impacted by AGN are the kidneys, but as the filtration rate decreases, the patient can begin to develop severe secondary issues throughout the body. The reduced filtration rate means that the kidneys are not filtering out waste and maintaining the body's electrolyte, which has several effects on all the other body systems. The patient will be at higher risk for effects on the heart as the blood pressure increases. The kidneys also produce erythroproteins, which stimulate red blood cell production. When renal function is negatively impacted, anemia can occur. The lack of filtration also causes toxins to back up in the liver, leading to liver failure and GI tract issues, such as diarrhea.
What would a nurse evaluate if you were suspected to have acute glomerulonephritis?
What's that? It sounds like one of those bugs you get when you're traveling. Maybe it's your stomach, I don't know, your throat, your blood, your poop, something.
More on that later. Not right at all, but...
What would a nurse assess with somebody who has AGN? Well, the nurse would want to perform a full head-to-toe assessment to gather a baseline for the patient. During a head-to-toe assessment, it'd be important to get a full set of vital signs, determine the mental status, palpate the kidneys, do an abdominal assessment due to the potential of abdominal pain, a lung assessment in the case of edema, and a cardiac assessment to determine if the disease has affected the cardiovascular system. Throughout the full body assessment, the nurse would expect to find the patient to have pale skin, edema around the eyes and in the legs, ankles, and arms. A urinary analysis test would show results of blood in the urine, azotemia, and proteinuria, which is protein in the urine.
Good job.
Okay.
Or whatever.
Can you get my number? That's very flattering, but I'm gonna have to pass. But thank you. Have a good one. And thank you so much for that. Not right at all. We will get back to you.
Acute glomerulonephritis.
Acute
Glomerulonephritis.
glomerulo. I cannot see.
Or AGN. Just say AGN.
AGN, I like that.
Yeah.
Okay.
That's it for today, you guys. Thank you so much for watching.
I hope you found this information helpful.
We have a couple NCLEX questions coming up next, so stay tuned.
If you have any extra questions, feel free to let us know.
Thank you again. Bye.
Bye. Oh, goodness.
Now it's time for a couple of review questions about acute glomerulonephritis. First, acute glomerulonephritis secondary to bacterial infection is commonly associated with this pathogen: H. pylori, Group A beta hemolytic streptococcus, E. coli, or C. diff. C. diff is seen most commonly as a secondary effect of antibiotic treatment when the normal flora of the GI tract is eradicated, leaving room for C. diff infection to become established. H. pylori is largely responsible for peptic ulcer disease and manifestations in the GI system. E. coli might trip you up because, as you know, E. coli is the bacteria that is commonly responsible for UTIs. And this can lead to pyelonephritis, which is a postrenal kidney infection. It develops downstream from the kidneys, if you will, within the renal system. Acute glomerulonephritis is an intrarenal condition where the kidneys themselves are impacted by inflammation. So the bacteria most commonly associated with this condition is in fact Group A strep. This disease progression may sometimes manifest as the classic signs of strep throat, followed a week to 3 weeks later by the onset of a kidney infection. Next question. If left untreated, severe forward effects of acute glomerulonephritis on the body's systems can include, select all that apply, heart failure, hypertensive crisis, shock, GI bleed,
pulmonary edema. So going through these options, we are going to rule some out and then determine which ones are correct. Again, when we think about the systemic effects of acute glomerulonephritis, the glomerular filtration rate is lower, urine is not being produced and excreted efficiently, and that excess fluid is building up in the body, causing hypervolemia and its associated manifestations. And when we are looking at severe effects, AGN is the initial infection that leads to end-stage renal disease in a significant percentage of patients, especially pediatric patients with renal disease. That being the case, we are less likely to see shock. This would be correlated more typically with severely low blood pressure, which is the opposite of what is likely to happen with acute glomerulonephritis. Another effect we would not expect is a GI bleed or internal hemorrhaging. We might see some blood cells in the urine, but we would not see evidence of a GI bleed with this condition. What we would see is hypertension. Again, if left untreated or if the patient has pre-existing risk factors, this could be severe. There would be edema. Most patients will first present with facial edema or periorbital edema around the eyes, but this can spread throughout the body as well, especially as the condition is left untreated. And this can also progress to heart failure, which can occur due to hypertension and hypervolemia. Again, these would be severe late-stage findings once the infection progresses, but consider what else is happening within the body and how those systems work together. Lastly, here is a list of our references. Thank you for watching.